you want or as difficult as you want. That's your choice. And nobody should go to rehab and enjoy it, but they should go to rehab and feel fulfilled by the end result. You don't want to force somebody to do something they don't want to do. I would say rehab is discovery. So rehab is about discovering your person, discovering new coping skills, discovering some of the trauma that you've probably got that you didn't realise. And that's what you'll go through in the 28 days, a journey of discovery. When you leave the rehab, then you go into recovery. So that's when you have to maintain it.
What is important is sometimes you've got a clear mind now where you haven't touched any substances. So you've got a period where it could be 15 days, could be a whole 30 days, where you actually start to think that you get to know what your own self, what is actually what I'm missing, what is life. You might cherish your family or your loved ones a bit more. Your well-being is improved. You're actually communicating, whereas before you didn't want to communicate. You shut everyone out. So I think sometimes this is a safe haven where you can actually come and reflect not just on your actual addiction, but on your life itself.
And I think also physically people recover quite quick. So they come in and they're a bit broken and they have the shakes or they can't sleep, and then very quickly they start physically feeling stronger. They maybe go into the gym, they're sleeping better, but psychologically that's when the work needs to begin. So you see people after 1 week, I'm going to the gym, I'm eating well, I'm sleeping well, I'm okay. And we're like, no, this is a journey, do you know what I mean? And it's an ongoing journey for the rest of your life to get better and work and maintaining it. And like 𝗪𝗧𝗧 said, you start seeing things in your life, your children, your education, getting a better purpose, getting a better meaning. But it's not just the 28 days or however amount of time you're in the rehab, it's what you do after. Hence why we have a very good aftercare program as well to support people in that. It's very easy to put somebody in a rehab for 28 days and them not use substances because there's none in here. But it's when they leave, they need that support which we've put in place with our aftercare program to monitor them through their way. Because the recovery I had when I first went into rehab 19 years ago, if I still had that recovery now, it wouldn't work now, because 19 years ago I was a single guy. Now I'm married with children, so my recovery is different. So we make sure that we help them maintain their recovery for the long term.
And I think one of what's really crucial is sometimes people actually, when they come into rehab, they think more or less it's like a boot camp or like a school. No, actually it's no different than being home, but all is you're actually getting the support. You're getting people checking up on you, you have a nurse on site who's checking, ensuring your medication is taken on a daily basis. Worst comes to worst, we can have a doctor on site as well. You've actually got people checking your well-being. And so it's no different to actually being at home. But actually when people come into rehab, they like, why didn't I book this in rehab before? I should have done this ages ago. Till you actually acknowledge the problem and responsibilities, and I think that's when you actually realise you need the help and support you need.
And that probably goes into when we get the question, can you force somebody to go to rehab? If you force somebody to come to rehab, they're only going to be here because they've been forced. So they're not going to be perceptive to do the work, they don't want to be here, and it can be quite challenging for them and it can be challenging for the group. Hence we do a very big assessment prior to people coming in. We always want to speak to the actual client before they come in. So if a family member refers their son or their husband, we say, okay, fine, but we need to speak to your son and husband to make sure that he wants to come in and is going to be participating in the program. Otherwise it's not good for the person because they don't want to be here, and it's also not good for the group that's already here if you've got somebody that doesn't want to be here. So it's not just about filling the rehab up and having it always full. We want people that want to change, that want to support, because we're building a community. So forcing people to go into rehab is not an ideal solution. Do you know what I mean?
And one of the common questions that we come across is, am I allowed to use my mobile phone or laptops or my devices? Absolutely you can, but what I would say is you've got to appreciate you're actually here to get help, and you don't want your phone or your devices going off while you're having therapy or group. So we'll give your phones back. We're able to appreciate that. You have businesses to run, you might have work issues that you need to actually go on a laptop and use a device. So you're more than welcome to have those devices, but there's a limited period when you can actually use them, because it's not fair on the other people paying money to be here, and then you're actually distracting their therapy services.